Every single person that I've worked with that has had Tommy John had warning signs. Months, sometimes years before it even happened. His body was telling him something, but nobody was listening. Not his coach, not his parents, and honestly, probably not him either. I'm Matt Clark, a former Division I pitcher and a current baseball physical therapist. I've spent years screening throwers, rehabbing throwers, and unfortunately, even prepping them for surgery. And over that time, I've landed on 10 specific things that I like to look at for pitchers to see if they're going to be at risk for Tommy John. Now these 10 things, they're not in a specific order, but the more of these boxes that we can check, the less of a likelihood that we're going to be a ticking time bomb throughout the season. Now some of these have rock solid evidence behind them, but then the other ones are just from things that I've seen through my time at the clinic. So go ahead and grab a pen, because I want you taking notes to see where you stand at the end of this video. Let's get into it. The first thing that I'm going to look at with every single pitcher is their total shoulder motion or their shoulder arc. Now all this number is a combination of your internal rotation and then also your external rotation. The research here is pretty strong here with this one. Pitchers with under 160 degrees of that total shoulder arc showed altered mechanics, and especially during that late cocking phase. Therefore, it resulted in an increased amount of stress on that upper extremity when throwing. And guys that had a 5-degree deficit were linked to a 2 times higher likelihood of getting an elbow injury. And so the research here shows 160 degrees, but honestly, I push for about 180 degrees or even a little bit higher with our throwers. This is going to give us more of a buffer before we start to get into that danger zone. If the shoulder won't give the body that range, that elbow is going to start absorbing angles that it was never meant to absorb. All right, so let's get into GERD, or glenohumeral internal rotation deficit. This term is thrown around a lot in the baseball world, and for good reason, because losing internal rotation is extremely common in baseball players. But here's where people get this wrong, and the research does back this up. Studies have shown that when a pitcher's throwing arc stays symmetrical between the throwing arm and the non-throwing arm, even if internal rotation is reduced, that's considered a normal adaptation, not a red flag. But the goal here isn't to get excessive external rotation either. That's not what we're after. What we want to do is optimize that internal rotation so that we can get that shoulder arc to about 180 degrees. All right, let's talk elbow extension. This one sounds almost too simple to even matter, but it's not optional. If you can't fully extend the elbow on that throwing side compared to your non-throwing side, that's a sign that your elbow is not moving the way that it should be and it's not ready to throw. And when a joint doesn't move the way that it's intended to, we're going to compensate elsewhere. And compensations are potentially going to lead to more stress on that UCL. It's an easy self-check that you can do right now, but it's one of the most overlooked things with baseball players. This one's going to surprise some people, but it's your neck. Emerging research is starting to show that pitchers with limited neck mobility have a spike in arm injuries. One study in college pitchers found that the pitchers with decreased neck mobility preseason were linked to a higher incidence of shoulder pain and elbow injuries throughout the course of the season. So think about that for a second. A restriction way up into your neck, showing problems way down the chain into your shoulder or even into that elbow. It's not something most guys would think to check before a season starts or even maintain throughout the course of the season. But it's quickly becoming one of the most overlooked pieces of that kinetic chain. So that's why it's on this list. It's on this list for a reason. So this one's different than the first 4 because it's not a mobility test. It's a strength test. After you release that baseball, your shoulder external rotators are essentially the brake for your shoulder. They are what's going to help that arm decelerate and help prevent that arm from just flying forward uncontrollably. And if those muscles are weak, that braking job is going to be passed off to something else further down the chain. And a lot of the time, that something else is going to be your elbow. Your legs are supposed to start that delivery. And pitching is a single leg sport essentially. You're loading into one leg, you're firing off one leg, and you're planting on one leg. So if you can't reverse lunge 1 times your body weight with control, that tells me that your legs aren't where they need to be. When one leg can't stabilize or produce force on its own, that arm's going to have to make up the difference to help get our velocity. So weak single leg strength quietly translates into an overworked arm or just an inefficient kinetic chain. A lot of people don't connect those 2 dots. All right, this one's all about force production. The deadlift. Guys who can pull twice their body weight tend to have that strength floor to be able to tolerate that high intensity pitching. The volume, the velocity, and the workload spikes that all come throughout the season. This isn't about turning pitchers into power lifters. It's about making sure there's enough total force production capacity underneath all that arm care work so that that arm care work actually matters. Now I want to be pretty direct with you on this one. because it's not biomechanics this time. But this one has some of the strongest data to back it up. Any pitcher that is currently throwing through arm pain and they're not doing anything about it, they just keep plugging away, well, they are actually going to be 36 times more likely to develop a significant arm injury. 36 times. Pain is information. It is your body flagging something that is currently being overlooked. Throwing through it doesn't build toughness. It takes a small manageable problem into a torn UCL and an entire year off. So if it hurts to throw, the answer is not to push through. The answer is to stop and find out why, every single time. So I bring this one up in just about every single video that I make. And I'm not going to stop because the research backs this one up pretty hard. Athletes who consistently sleep less than 7 hours a night, sustained for 2 weeks or more, are almost 2 times more likely to develop a musculoskeletal injury. Tissue repair, recovery, adaptation from your throwing program, none of that happens the way that it's supposed to if we're sleeping less than 7 hours a night. You can build the most perfectly designed arm care program in the world, but bad sleep will quietly undo it night after night. Okay, final one. Let's get into acute to chronic workload ratio. This is the one that almost nobody tracks, and it's genuinely well-studied territory. Now there's some numbers that we like to look at as clinicians to see if pitchers are where they need to be throughout the course of the year in terms of how much that they are actually throwing. And when we consider this acute to chronic workload ratio, a 0.8 to 1.3, that tends to be the sweet spot. This sweet spot helps minimize injury risk across all sports. For baseball, it compares your recent throwing load to your longer term average. So if you're a pitcher just working on tracking the workload on your own, it might be tough to find that actual number to try and land in that sweet spot of 0.8 to 1.3. So if you're having a hard time doing this, essentially what it means is we don't want to either ramp up too quickly, but we also don't want to stay ramped up throughout the entire course of the week. In summary, we want a good build up before we're 100%, or we want to be mixing in some lighter intensity days throughout the course of the week. If you do this, your injury risk is going to drop dramatically. So there's a list, 10 things. But I do want to be honest with you. Checking all 10 of those boxes, it's not going to guarantee that you don't tear your UCL. Nothing guarantees that. Some of these are backed up by rock solid research. Some of the research is still developing, and then some of them are just things that I've witnessed throughout the course of my time in the clinic. But I will say, the guys that can check those 10 boxes, they throw harder, they throw longer, and they stay off that surgery table. So go back through that list. Be honest with yourself and see where you stand with each one, not where you think you should be, where you actually are right now. That honesty is where injury prevention starts. Alright, so that is a wrap on this video. If you guys need help dialing in your arm care program, I'll go ahead and link my arm care protocol in the description below. And if you're looking for daily content on how to perform better or just stay healthy, go ahead and check out my Instagram at @MattClark_DPT. Alright gang, I'll see you guys next Monday.